Dr. Chikwe and Vivian, thank you so much for joining me. I'm really excited for this conversation, and I'm hoping that my audiences would also be excited to hear from you and the amazing work that you've been doing for the world and Africa in particular. So welcome to my podcast, the Global Health Uncensored.
Great to be on your show, man, and thank you for the work you're doing. Actually, great job sharing thoughts and thought leadership with the world.
Pleasure to be here too, Banda. Really lovely to be on your podcast.
Mm, So I guess we'll start from how everything unfolded. Can you both share some stories from your early life and how those experiences have shaped your career till now? Um, Let me start with Vivian.
Okay. Thank you for that question, Banda. That's a really interesting one. How did my early experience shape my current career? I think for me, my previous, experiences, which, saw me living in different countries at a very early stage, exposed me to different cultures and living with different contexts and different people. And, the nature of public health is having to engage with the public, having to find those commonalities to, for instance, communicate. Something that is a focus of my work. So I think my early career kind of shaped an understanding and appreciation for learning to live and dialogue with different people. And I think in public health communications has a very important aspect of ensuring that you're able to engage with people with whatever public health message that you're trying to disseminate. So I think for me, my early experience kind of shaped a lot of how I see things and how I view life and the world right now.
Okajikwe, how was your early experience like?
I think, like most other physicians, you train to treat the patient in front of you, and that's kind of what you're preparing for. And that was the journey I was on until through a set of circumstances, and I described that in the book, which your audience will read. I
Mhm.
got distracted and got went into public health, really to as a stopgap measure, right? Then to continue on the clinical path. But I think what I really enjoyed with my early exposure was this uh, complex, challenging problems. In clinical medicine, yes, some things are challenging, but many things, if you make the right diagnosis, you provide the right set of, uh, uh, you know, resolutions to whatever the challenge is. Most of the time, you either have an improvement or you don't. There's a linear path or not. But with public health, there's so many different factors that influence an outcome, and I love the complexity that brought into my own development.
Yeah, I kind of understand that perspective a little bit, and I know how the clinicians also have a different perspective about public health physicians. And I told my one of my professors back in medical school that I'm interested in public health. He said, "Why am I looking for the easiest path?" So they also believe that public health is like, oh, you don't want to, you don't want to take
It's
on a
easy.
challenge, but
Not.
it's more challenging being in public health than the straight path, as you rightly said. Um, Miss Vivian, I know you've been in leadership position for a while. What are some of the challenges that you've encountered as a woman leader in public health, and how have you gone through them successfully?
Okay, I think for me, being a leader, a female leader in any context, I think the context in which you operate makes a difference on how you're able to, do your work. So, for example, my organization, Nigeria Health Watch, is based in Nigeria. And one thing we see often is a lot of the health challenges that we face in Nigeria disproportionately impact women. But unfortunately, in a country like Nigeria, a lot of women you don't often find them in leadership positions. So what you often see is that health policies don't often listen or integrate the perspectives of women. So, in the health sector in Nigeria, we don't have enough, or we don't have enough women in those leadership positions to be able
Mm-hmm.
to have that direct influence on health policy. I'll give you an example. Recently, the violence against persons was is currently being reviewed in the Nigerian House of the Republic. So what that has seen is that suddenly a law that has an impact on domestic violence, or how women are able to seek recourse, um, is looking to be repealed. There wasn't any consultation. The people who make those decisions are not women. So as a woman in public health, sometimes you do encounter those challenges where when you do face those bottlenecks, you don't have enough women in those leadership positions who are able to push and drive through policy. So I think going forwards, we saw with the COVID-19 pandemic, a lot of people who are the front lines of delivering care were women, but when it came to the decision making around the response, a lot of them were men. So I think pushing forwards, we absolutely, especially in the health sector, you need a lot more women in leadership positions.
Okay. I mean, you're certainly right, and I think this is one of the areas where a lot of women leaders that I've spoken to are very passionate about, including Dr. Ebere and Dr. Etiebet, very, very passionate about women inclusivity in global health. Dr. Chike, I know you started off as a clinician, but in transitioning to public health leadership, what challenges did you encounter as a physician who's trying to move into clinical to public health? For me, I knew one of the issues were that my family were kind of surprised that we've sponsored you to go and become a doctor, but now you're not seeing any patients. How has the experience been so far?
Yeah, I think it's you know, there are not too many public health figures that we look up to in our country. So there are not too many role models um, that will say, okay, these are the models. The same way we celebrate popular clinicians in our context, and we've accepted many disastrous public health situations in Nigeria to be the norm. When you think about the high number of women that die giving birth, the number of children that die in Nigeria from malaria, more than any other country in the world. These are just numbers, and it's hard to translate that into the emotions that will drive action. So I think some of the frustrations is just how to bring the challenges that we face to life, and to get Nigerians and Africans and people around the world to see that this is not normal. The situation we face in Nigeria, with so many unnecessary preventable deaths
Mhm.
happening, cannot be normal and should not be accepted. And this is something I think arousing both political and emotional societal attention to these challenges is probably, I think, the biggest challenge that we face.